Okay, so here's my proctor. And then this will be my documentation sheet. It's blank. So I would first want to start by verifying the provider's orders, that an NG tube is what was ordered, and it was. Then I want to check for any patient allergies to any of the supplies I would need to use that would hinder me from continuing with the placement of the NG tube. They don't have any of those. And then I would also want to look through medical history for any nasal or gastric surgeries, and none of those were present in their history. So we'd be good to go with that. I have gathered my supplies, and for selecting a NG tube, I'm thinking about things like my patient size, what the tube is being used for, and how long are they going to have this tube. So I've selected a 12 French tube for my patient. So I've gathered my supplies, and then I would enter my patient's room, provide for privacy. I would perform hand hygiene with the hand sanitizer on the wall, and then I would introduce myself to my patient. Hi, my name is Kylie. I'm a nursing student, and today I'm going to be placing an NG tube for you as your provider has ordered. Before we get started with discussing anything, I'm just going to go ahead and have you confirm your identity. So can you tell me your first and last name, your date of birth? Okay, and do you have any allergies? Perfect. This patient has confirmed themselves using 2 identifiers. I checked their wristband also while they're telling me, and they've also reconfirmed that they don't have any allergies that would prohibit me from continuing. So then I want to discuss with my client what this process is going to look like, ask them about any history of NG tubes, and establish a distress signal. So have you ever had an NG tube before? Okay, so a patient's had an NG tube, so you might be a little familiar with the process, but I'm still gonna explain step by step what we're doing, especially as we go, make you as comfortable as possible. As you know, the process can just be a little bit uncomfortable, so I want to go ahead and establish a distress signal. So if at any point during the placement of the NG tube we need to stop, take a break, you're in any distress, anything like that, I just want you to tap on the rail or raise your hand and we will stop and take a break, okay? So an NG tube is placed for things like suctioning or feeding. So in this case, your provider has ordered it for suctioning of gastric contents. And so what the process is going to look like is I'm going to insert a tube through your nose, down the back of your throat, and into your stomach. So like I said, this will be a little bit uncomfortable. I'm going to do my best to make sure that you're as comfortable as possible during the procedure, and I'll kind of walk you through it. My first step though is I want to place my patient in a high Fowler's position. So I'm going to sit you up really tall, okay? Okay. I'm going to lower the bedside rail. And then I'm going to go ahead and look in both my patient's nares, looking for a deviated septum or things that would make it difficult or very painful for the patient to place an NG tube. So I would take a pen light, look in each nair. Okay, both of them look pretty clear, and then I want to check airflow of the nares too. So I would instruct my patient to do that. So I'm going to have you occlude one nostril, and I want you to take a deep breath in and out through your nose. Perfect, same thing with the other nostril. Awesome. So after my patient did that, I have heard that my patient's right nair has the best airflow. So that's the one we want to use to place our NG tube. So now I can go ahead and gather my supplies, get all that ready. So I have my catheter, and I will go with that. And then I want to go ahead and measure from the tip of my patient's nose. I'm going to pull your gown down for just a second. This is just for measuring how long we need our NG tube to be inserted. And I would want to measure from the tip of the nose to the earlobe, and then from the earlobe to the xiphoid process. Okay, so that was at 43, and then I would want to take my pen. This would be like a red marker or red pen, and I would mark right there at the 43 mark. And then I'm going to go ahead and attach my syringe. And we want to make sure that the end of the NG tube always has something on it when we're placing, so no gastric contents come back up at us. Okay, so I'm just going to rest this back on the package and put on some gloves super fast.
The size of the tubing, make sure that we get that correct.
And then we're going to pull your gown back up, and I'm going to I'd place a towel or a chucks over the patient just in case any vomiting were to occur or anything like that, just so it wouldn't get all over their gown. Then I would also give them a basin, again, just in case they threw up. And then I would give my patient a cup of water. So I'm going to have you hold this cup of water, or I could have a nurse or CNA with me to help me during this process. Give my patient their cup of water. During the procedure, I will instruct you when to drink the water. That's just going to make the process a little more comfortable and easier to place the tube, okay? So I would give my patient that.
Put that back in here. And so now that we've got
And then I would have lube, and I would lubricate the first 4 inches of the tube. And then we are ready to place. I have coiled the catheter. This also just makes it easier to place so it bends correctly and isn't too stiff. Okay.
And I'm going to give you a glass of water.
Perfect. So we're going to go ahead and start this procedure. I'm going to have my tape ready to go as well. And I'm just going to place this on my bedside table. Okay, so I've looped the end of my catheter, and now we can go ahead and begin.
So now
I'm going to have you bend your head forward when I first insert it into the nostril, and then I will instruct you to lift your head up and take sips of water, okay? All right. You ready? Lean your head forward.
beforehand, I let the tube touch the bed a little bit.
Insert, insert. Okay, lift your head up, start taking sips of water. Good job. Sip, sip, sip. Keep sipping. Perfect. And then we've gone to that 43 mark. And I'm going to go ahead and temporarily secure it with a piece of tape. So now that I have my NG tube placed, I want to make sure that it is in the stomach and in the correct spot. So I'm going to aspirate using the syringe on the end of the tube. I'm going to pull back on that. And I have visualized gastric contents. It is green gastric contents, so we know that we are in the stomach. Another way we could check that would be I would clamp the end of the tubing. And then I would disconnect the syringe. And I would have another nurse or CNA or already have pH paper ready. And I would add a drop of the gastric contents to the paper and check the pH. So I've done that. pH was 3 and gastric content pH should be 0 to 4. So that's another indicator that we are in the stomach. And then if this tube were being used for feeding, I would get an x-ray before ever doing any feedings. So then I reconnect the syringe and I can unclamp. And then I return the gastric contents per agency policy. Okay. So then I'm going to go ahead and disconnect the syringe. And then I want to clamp the end of the tubing so gastric contents don't come back up. And then I'm going to secure the tube.
So we use the red one. Just keep swallowing. Gently swallowing. Keep swallowing. Keep swallowing. And
Perfect. And then I'm just going to place this under the nose.
do you have any discomfort at all? No, great. So I'm going to take your
Okay, and while still holding the NG tube in place, I'm going to remove the temporary tape. And then I'm going to secure this tube. Okay, so now that NG tube is secured to my patient, I can remove the towel. And then I would want to secure the end of the NG tube to my patient. I want to make sure that I leave some slack so when they move their head, it's not being tugged or pulled out of place. And then I would also connect the end of my tube to whatever the provider has ordered. So suctioning or feeding or anything like that. So this is attached to my patient and it's hooked up to the appropriate means that my provider has ordered. I would perform oral and nasal hygiene, making sure that the mucous membranes are staying moist and that there's no irritation with the NG tube. I would dispose of all my supplies and wash my hands, and then I would document appropriately and check back in on my patient and make sure that they let me know if they have any nausea or vomiting. Okay? So I'm going to go ahead and raise your bed rail. Okay. Then I'm going to lay them back down just a little bit, but we want to make sure that they're still sitting at a 30 to 45 degree. The bed is raised 30 to 45 degrees with that NG tube in place. I want to make sure that the bed is all the way lowered. 3 side rails are up. Their call light is in their hand. Just let me know with your call light if you are having any discomfort, any nausea or vomiting, or if you need anything, okay? And then I would document.
Okay. And now